Good morning, remote attendees. We'll be starting the meeting in a few minutes. Thank you. Oh, I moved you.
Oh. With the hour having reached 10 a.m., I'd like to call to order the Cook County Health Managed Care Committee meeting. Would you please read the roll?
Director Harrington? Present. Director Webster Cross?
Present.
Chair Lowry?
Present.
And for the record, those directors also present. Director Ryder? You have a quorum.
Thank you. I'll now entertain a motion by Director Harrington to allow remote participation for directors who are attending the meeting but are not in the room. Is there a second? I'll second it. All right. All those in favor say aye. Aye. All those opposed? In the opinion of the chair, the ayes have it. Any additions to the agenda?
No, sir.
Any public speakers?
No, sir.
At this time, Director Harrington moves to accept the minutes of the Managed Care Committee meeting held on October 18th, 2024, seconded by Director Lowry. All those in favor say aye. Aye. All those opposed? In the opinion of the chair, the ayes have it. We will now hear a report from Health Plan Services presented by Aaron Galiner, Chief Administrative Officer of Health Plan Services. Aaron, the floor is yours.
Directors.
Good morning. Morning.
We'll start off today with our standard metrics and then move through our agenda, which is going to cover both a review of 2024 successes for the health plan, and then we want to spend most of our time focused on our plans for 2025. So starting off with membership, this is as of January 6th, we have 417,000 members in the plan. Membership's really stabilized over the past really 4 to 5 months as we've gone through this large wave of redetermination. We're now past that. We are transitioning into the phase where most of our members are going through their open enrollment cycle, where they have the option to potentially change plans either from county care to another plan or from another plan into county care. So that window for most of our members goes through February. So we'll continue to monitor membership, but I think generally membership has stabilized, and we're expecting it to be much more stable going forward than what we've seen in the past couple of years. The next slide shows our overall market share. This data is from the state, so it's only published through September of 2024. We're at 34.2% overall market share. As a reminder, heading about 18 months ago, we were around 33%, so we've ticked up over time, mainly because we brought on the healthy benefit for immigrant adult population into the plan. The rest of the market's been pretty stable. Blue Cross has consistently been the second largest Medicaid plan in the market with 27%. There hasn't been a ton of changes in terms of market share across the rest of the plans. This slide shows the overall membership trend. So on the right-hand side is the red line that shows overall Cook County Medicaid managed care enrollment. You can see the market's been shrinking overall, as we'd expect with redetermination. Again, the state is only through September, which is what was published from the state. You can see county care on the left-hand side on the blue line. So we were generally trending with the market, except we brought on the healthy benefit for immigrant adult population. So about 35,000 of those individuals came onto our plan between January and April, which caused the increase. And then we resumed some of the decreases along with the rest of the market because of the redetermination process. As we look forward, that again is pretty much flatlined from kind of October to current. So that's begun to stabilize. September, October were the last main months that we saw redetermination impacts.
So that's resulted in an increase in the number of uninsured people in Illinois?
I'm sorry, could you say that one more time?
Does that mean there's been an increase in the number of uninsured people in Illinois, and specifically Cook County?
I do expect that we've seen an increase in uninsured during that time. I think our health systems payer data has shown that as well. Some of these individuals may have transitioned on to exchange products or other commercial insurance, but generally, yes, we expect some of these individuals have moved to be uninsured. The next slide shows our membership compared to budget. We're starting off in a good position compared to budget for 2025. When we did the budget projections in June of last year, really there's two things that we've outperformed on over the second half of 2024 that's put us in a better position than expected starting this year. Those two things are we're performing better than expected on the retention rate for individuals going through redetermination. And then the second item is historically about 20% of individuals that were making a choice of a health plan when they came into Medicaid were choosing county care. That number is now increased to around 30 to 35% every month with some variation. And so we're seeing more individuals come into the plan that are actively making a choice of county care as their Medicaid managed care plan. So as a result of that, we're ahead of budget here starting off in December and January. As I mentioned, we do expect some impacts here as we go through the open enrollment period, but otherwise we're, again, expecting a pretty stable environment for membership going forward, absent any federal policy changes. This slide shows our operations metrics. Everything here is within SLAs, so no real call outs. I think we're continuing to monitor our inbound call volume. We've put a lot of work recently around our call center to ensure that we're staffed at the level that we want to be for the quality of customer service we want to have there. So that's really been an emphasis for us. So you can see some of the impact on percent of calls answered within 30 seconds, how that's been increasing, and some of the abandonment rates been decreasing. But we're also heavily focused on the quality of those encounters between members calling in and the information they're getting through our call center process. This slide shows our current versus prior year inpatient admissions per thousand. So the red bars here are the prior year time frame. The blue bars are current period. We've been expecting, throughout the pandemic, as our membership was growing, we saw decreases in utilization per thousand, which was expected. We've been expecting that trend to reverse, and so we're seeing that in the data here, where our current year utilization is now outpacing where it was previously, and that's really a result of now that redetermination has flowed through the data, the population that we're left with within the health plan is higher acuity. They have more medical needs than the population we had prior to that redetermination process. So we are also seeing some of these utilization trends start to stabilize now that we've gone through a lot of those shifts in our population because of redetermination. And so, again, we expect this to be pretty stable moving forward, but something we'll be keeping an eye on. This slide shows our claims payment trends. Not surprisingly, there's a spike up that we see at the end of our county fiscal year. That tends to happen every year as we get to the end of the budget cycle and there's a rollover process. And then, you can see we've started to trend back downwards now that we're into the new fiscal year and can accelerate those payments back out. We're in a pretty good state. Currently, we're continuing to push out payments to bring that down to the 30-day mark, and I expect we'll be there over the next month or so. Yeah.
I have a question about the prior slide. Does the increase in acute admits increase our costs?
Yes.
Yeah. And so we're tracking that as well.
Yes. And I should say, to the extent that those increases are really a shift in kind of the demographics of who we're serving, which generally has been the case, we also are receiving higher revenue for those members. So we're left with a population that's somewhat sicker in the plan, but we get additional revenue for those members, and we see higher utilization and higher
It'd be
costs for
interesting
them.
to see what that looks like.
And then this slide just breaks down our claims payments by each aging category, 30, 60, 90. As I mentioned before, we see some increase as we head into the end of the year. You can really see that in the 30 to 60-day category, and then you can see that started to decrease, which it will continue to do as we head into the new year. So with that, I want to transition into a look back at 2024 and some of the successes for the health plan. The biggest achievement being our 4-star rating under the NCQA health plan ratings. NCQA is the national accrediting body and also the standard for how health plans are measured on their quality performance nationally. Only 20% of Medicaid health plans across the nation received a 4-star or greater rating in 2024, and only two Illinois Medicaid managed care plans, County Care and Blue Cross, received the 4-star rating. We also went through the regulatory accreditation with NCQA this past year and received our reaccreditation. Both this and the quality scores are really whole plan efforts by our teams, and so a lot of dedicated work by our team members to get us across the finish line on both of those. And certainly want to acknowledge and thank their work. This accreditation is for 3 years, so we're back up again in 2026.
Yeah, I want to commend you for that, but also, does this provide an opportunity for marketing our rating?
Yes, absolutely. We've already started pushing out some information about our 4-star rating out there through social media and other channels.
Aaron, let me add, I'd like to follow up with you and talk about which of these items we should share with the Board of Commissioners. This really is outstanding, and I'm a big fan of putting together brag sheets when you can. So let's do that and then get that circulated.
Yep, happy to work with you on that. This next slide shows our HEDIS vendor transition, which we went through over this past year. This is a transition to a new vendor that helps us submit and review our data around our HEDIS quality of care performance. This new vendor that we're moving to should provide us a lot more flexibility and a better foundation to continue to increase those quality scores over time. So we're excited about this transition that we put in place in 24. I think that'll have a lot of benefits to us in 2025 and going forward. We also moved to do a lot more community outreach and engagement. We've built a community outreach team over the past 18 months or so that's really out 5 days a week, doing a lot of great work around redetermination events. We also held our first community baby shower, which brought in individuals at Providence Hospital and included, presentations and partnerships with community organizations that were also present around pre and postpartum care. Also was a great chance for us to bring in members that we wanted to engage with and get connected with them, as well as their family members that are importantly their support system as they go through the pregnancy process. We also held multiple health fairs this year. Again, we tried to target some of those around Provident Hospital. We provided information and services to 95 women at the Women's Health Fair and 45 men at a Men's Health Fair. Again, both of those were at Provident and focused on members in the surrounding community. The plan also received 3 National Association of County Awards, including a Best in Class, Best in the Health category for addressing food insecurity for our food nutrition program, as well as recognition for how we engage members during redetermination and work we've done on improving member demographic data across the plan, which we're then leveraging to be able to do things like outreach to members in their preferred language and use for other engagement tactics across the plan. We've continued to build out what we call our food care program. So this is our food nutrition services for members. This really has 3 core components: our emergency meals, general nutrition program, and medically tailored food. On the emergency meal side, we've serviced almost 2,100 members and almost 30,000 meals through the emergency meals program, which is providing a set of 14 prepared meals to individuals within 48 hours of the request. And when our care coordinators see a need for an individual that's in an emergency situation, we're able to quickly respond to that. There's also general nutrition guidance and support with dietitians that members can access, as well as some grocery planning and budgeting support that's provided. We've had 67,000 total members through December of last year that have engaged in that program, and we're continuing to see that build over time, and have gotten a lot of great feedback, both from members and from their PCPs that often are interacting with that general nutrition program. And then finally, we're continuing to build out and grow the medically tailored food aspect of this program. So this is meals that are targeted to individuals with specific chronic disease conditions, so things like obesity, diabetes, gestational diabetes. We've got 3,700 individuals that are engaged through that program, and I think across all of these, as we begin, we're far enough in now that we're starting to see a lot of the program outcomes from this. So we're seeing really good results in terms of things like decreasing A1C scores, weight loss, other nutritional education measures that are improving. And so we're excited about how we can continue to refine this program and really target it towards, I think especially on the medically tailored meals front, chronic disease populations that we can really impact with this.
Yeah, what kind of nutritional guidance and support are we giving to patients?
So it provides access to dietitians visits, and so members have a platform they can access and do nutritional visits with the dietitian, and then there's additional education. There's also information they can receive and platforms they can access with healthy food choices, and there's even things like, if they're going to order at a restaurant, there's kind of flagging across menus that shows them what meals have better kind of nutritional value scores than others.
Do we have information that shows a connection to nutrition and a healthy diet to chronic conditions that wind up with people having to eat medically tailored food?
Yeah, we definitely have data around the impact that we're seeing both within our population on the program, and of course some of the broader research we've seen in those areas.
Yeah, but do we have tools or do we have information that we can share that relates to that?
In terms of like program information?
Yeah, just what a healthy diet is, what you should be eating.
Yeah,
and
absolutely.
advising our patients that these are things that you should avoid and these are things you should eat.
Yeah.
Okay.
If you know, have we initiated in a formal way the Food is Medicine initiative, which was first introduced by Commissioner Deere?
Yes, it's definitely been tied in and kind of integrated with some of the work that's happening here, and we were definitely heavily involved with Commissioner Deere's initiative around that.
If there's a point person, please share it at some point with me. I want to follow up on that in a very purposeful way. Okay, Thank you.
Is there any way to measure this in terms of impact?
Yeah, so there's both a series of process measures we've looked at just in terms of how many members are engaging, how many visits they're having, those kind of basic measures. But now that we're a year plus in, we're also able to really start seeing some of the outcome measures. So are we seeing an impact on A1Cs for members enrolled in the program? And happily I can report that that we are seeing that, and happy to bring some of that data back.
I would be very hopeful to see.
Yeah, sorry, Deb. We've also continued to work with our flexible housing pool. So this is a pool that's used for permanent supportive housing for individuals. We have 51 members currently in this program. We've housed 71 individuals since the start of this partnership. This provides permanent supportive housing for 3 years, plus wraparound services for individuals to support them, so care coordination and other direct supports. We target this really high-risk individuals, individuals with behavioral health needs that are also housing insecure. And we've seen really interesting results from this as well, some of which we've highlighted here from the overall flexible housing pool evaluation in some of the early years. So we've seen a 22% relative risk reduction in jail registrations for individuals, 19% reduction in emergency department visits, and a 33% reduction in inpatient days for individuals enrolled in the program. So we're continuing to build out our suite of different housing services. We can try to meet members where they are across the spectrum of housing needs. This is kind of at the far end of the spectrum of some of the most high risk, but we'd like to also be able to support individuals from everything from eviction prevention assistance to transitional housing up through permanent supportive housing, because we know that individuals that are worried about where they're going to sleep that night obviously have other priorities going on necessarily than their health, and so this helps free up capacity for them to be able to focus on some of the health and healthy activities that we want to support them with.
Do we know the number of unhoused participants that we have?
Dr. Collins, do you know that? Our next slide shows our initiative around lead poisoning prevention, which we launched this year. This was a coupon that we sent for water filters that are certified to households that had children 12 years or younger. About 89,000 different households received that coupon that they could redeem for that water filter that is certified to prevent lead poisoning. Almost 7,900 of those have already been redeemed through December, so we've seen a really good uptake in that program, and we've tried to target this and education around this for a lot of the areas that we know there's historic infrastructure with lead pipes across the Chicagoland area, which is a particular challenge, and is going to take years for the replacement of those pipes over time. So this is a more immediate prevention measure that we can take. And then the plan was also recognized in 2024 with what's called some APEX awards, which are the Health Plan Association in Illinois around work we've done to leverage value-based care to improve member outcomes, and also the work we've done with our provider relations and engagement teams. And then we've also launched a new provider directory towards the tail end of 2024. This is something I'm particularly excited about because it really provides a much more user-friendly experience for individuals that are trying to identify a doctor. There's still a lot of work we're doing in terms of cleaning up some underlying data and also providing some additional information through our directory as individuals are searching. So things like, can identify languages that providers are able to offer different hours, kind of outside standard hours, So all of these we're hoping to target towards member experience and their access and ability to really get connected to care. I've talked a lot over the past 18 months about redetermination. Again, want to take a moment to thank our teams that have been working on this. We've had a really holistic strategy across every touch point with the plan that a member has, whether they call into the call center, whether they go to their PCP, whether they go to the pharmacy, where they get education and information that they're up for redetermination. That work will continue. So, redetermination still happens every month. We're just through this large wave that individuals had to go through the first time since before the pandemic. So we've built a lot of really good infrastructure over the past 18 months, which we're now able to continue to leverage, I think, in a pretty efficient way. And as we head to 2025, we'll have, I think, some capabilities to shift some of that infrastructure we've built to now be able to add on things to help them with closing care gaps and doing some other things besides just that really focused work on redetermination. So I think this is going to be a big value add for us with the infrastructure we've built. This shows some of the work of our community engagement team on redetermination events. So they held over 240 events last year and touched almost 14,000 members from this. So we've continued to see really good feedback from these community events. And like I mentioned, we're now looking at ways that we can pivot some of that work where we can add on some additional opportunities to close care gaps and do other things so we've got a member right in front of us. Then we also partnered with our Cook County commissioners for our turkey giveaways this year. So over 3,400 turkeys and 6,800 side dishes were provided out. And I think also is a great way just to be out in the community and provide information to the community and some of our county care members. Then we've also launched our County Care Rewards You marketing campaign, which is out pretty heavily in the market right now. I think we've seen really good results. We'll come back to you at one of the next meetings with some of the data around that, but we've gotten really good feedback on this campaign so far and seen a lot of great increases in engagement in our metrics around this. All right, and then finally, we also brought on the healthy benefit for immigrant, adult, and seniors in 2024, and so this was another major effort. We had a few months to plan and prepare for these 35,000 individuals that came into our plan. We were able to outreach and engage and touch almost 70% of them within the first 60 days they were in the plan, get engaged, get them health risk screened, and then help support them across getting connected to care. And so you can see, we had a broad set of members, and I think this also helped us really think through and build out some of the work we were doing around our health equity approaches, how we connect with individuals in their primary spoken language. We provided some of the data here on some of the variety of languages that the individuals in this population that were coming in were speaking. And so I think, again, a lot of that work we're able to leverage now more broadly across the plan. And then I also wanted to highlight where we're at in terms of value-based care. So this is another core metric that we look at. We've got almost 60% of our plan is in, or of our total spend is in what's called Category 3 or Category 4, which are the highest level of alternative payment models. This is the highest across any managed care plan in the state, and really puts us as a leader nationally in how we're leveraging value-based care. So we're continuing to build on this. Overall, we'd like to get this over the next few years to about a 75% level. So we've still got some work to do, but I think are seeing really good outcomes from this work as well. All right, so this slide just gives you kind of a one-pager summary of a lot of that work. And so again, want to pause here and thank our county care staff and team for all the good work that happened over 2024, and I think puts us in a really strong position heading into 2025. With that, I want to transition now to talk about our 2025 plans. And with that, I'm going to turn it over to Chrissy Torino.
Good morning, everyone. My name is Chrissy
Good morning.
Torino. I'm the Chief Plan Officer for County Care. And I'll talk a little bit about some of the work that we have planned for the upcoming year. This on the slide is the framework that we use for all of the work that we do. It all rolls up to our Cook County Health Strategic Plan for 2023 to 2025 and the 7 strategic pillars that guide all of our work. Each year, we also establish year-end objectives and key results across those 7 strategic pillars. And then every quarter, we establish objectives and key results that we're working towards to incrementally make progress towards our year-end goals and have a work plan to try to achieve that. Yes.
Yeah, I see you use the word equity up there, and that's become a dirty word in some areas. How do you measure equity, or how do you monitor equity?
Yeah, so we stratify a lot of our kind of core quality measures, our HEDIS measures, by race and ethnicity, looking at whether there's disparities in different measures, and then especially targeting disproportionately impacted areas for the different services that we provide. For a lot of the services that we just talked about, like our food care program, and making sure that those interventions are in place.
Accessibility.
Exactly. Yep.
Do you use a social vulnerability index? I know public health uses a lot. Identify communities.
Yeah, I'm happy to. Yeah, so we primarily work within what we call disproportionately impacted areas, or specific zip codes where there's seen to be food deserts, just inequitable access to services within those communities. And those are the zip codes that we tend to target different services. We also look at whether there are just, in addition to race and ethnicity, look at whether there are disparities or inequities between disproportionately impacted areas within the Cook County area and those that are not considered DIAs.
Yeah, I'll just add to that. So the state does have some specific way they've defined disproportionately impacted areas, which they've flowed down to the managed care organizations. So that's kind of the main framework we've used. But we have done some review of the social vulnerability index, and one of the things that we see is county care disproportionately serves people higher on that index compared to the other managed care organizations across the county. One of the things we're thinking about in terms of our value-based care strategies is, are there ways to incentivize or leverage the social vulnerability index into some of the outcome and quality design of those programs and the financial incentives tied to those programs for providers in those areas they're serving those patients that are often more complex. So we have done some work looking at that, and I think it's a developing area, I would say, in managed care. Some places nationally have started to use that, and I think it's been interesting to see some of that evolve.
Well, as you proceed and there's enough data, it would be nice to look at that data and see where we are.
You can go to the next slide. And so we have set our fiscal year annual objectives and key results. You'll see those on the slide. And this is a continuation of our strategy that we've had over the last several years, and working towards the 3-year objectives and key results that we had set at the start of the strategic plan. So for member safety, clinical excellence, and quality, we, as you know, we earned a 4-star rating from NCQA. We're now going to be working towards a 4.5-star rating. For health equity, community health, and integration, we are focused on implementing the policies, procedures, and infrastructure needed for the NCQA Health Equity Accreditation, which I'll talk a little bit more about. And then we're also continuing to identify and address health-related social needs of our members with a focus on housing, food, and transportation. For member experience, last time and last year we had a a goal of the 90th percentile for rating of a health plan for our CAP survey, which is an annual survey that goes out to members. And this year, we're going to be working towards the 95th percentile. For workforce talent and teams, we receive an engagement score on our employee engagement survey every year. We saw some really great increases over the last year to a 4.18 out of 5 engagement score, and we'll be working towards achieving 4.3. For fiscal resilience, we have a goal of achieving at least 25 million annual margin and an $800 million fund balance for reinvestment in the Cook County safety net. And then for optimization, systemization, and performance improvement, our goals are really focused around achieving more access for our members, especially in areas of prevention. So for primary care, behavioral health, women's health, and prenatal care, and that's also in alignment with our goals of improving getting needed care and getting care quickly on our CAP survey. We're also working towards increasing and developing our data infrastructure within county care for allowing for dynamic reporting. And then from a growth perspective, we want to attain over 430,000 members across all products by end of the fiscal year 2025. And the whole framework around objectives and key results is to kind of set stretch goals so that you maybe achieve a little bit better results than you would otherwise. So these are really kind of our North Stars and the areas that we're focused on over the next year. And we'll talk a little bit about all the activities that we have planned to try to get us there. So this is a kind of a high-level view of our roadmap for 2025 and our strategic initiatives that will work to get us towards those goals. And we'll dive a little bit more into the detail, especially for the areas of quality, health equity, and member experience, and then talent and teams today. And then as we have future committees, we'll share some of our strategies in other areas as well. So for member experience, this is how we did last year. So for fiscal year 24, our objective was creating the best possible member experience. The key result we wanted to achieve was 85% for CAPS, for rating of a health plan for both children and adults. And we were a little bit shy of that for adults. We were at 83% for rating of a health plan. And for children, we exceeded that result of and getting to 91.2%. At the bottom of the screen, you can see that rating of the health plan is one of the key measures that is built into our 4-star rating for NCQA. So we actually achieved the highest rating across all the health plans of 4 stars in the state. And then for rating of care, we also achieved 4 stars. So this is going to be our area of focus as we build our strategy around member experience. Go to the next slide. So I won't go through all of these because many of them were highlighted during Erin's section of all of the successes that we had over the past year. But some of our kind of key areas of focus that were in alignment with getting feedback from our members in the CAP survey were getting needed care, getting care quickly, so expanding access to members, and then also rating of the health plan, which is a measure of overall satisfaction with the health plan. We, in addition to our CAP survey, we issued bi-monthly pulse surveys to get constant feedback from our members on things that they wanted to see improvement in, and then made improvements throughout the year. So we shared many of these successes with, I think, a highlight on our provider directory launch from an access perspective, and also bringing on more telehealth providers. All of the outreach and engagement work that we did in the community with our redetermination events, and making sure that we had a really easy front door for our members to be able to reach us. And then on our supplemental benefits program, we also made some really significant improvements, which I'll talk a little bit more about, especially in the dental and vision area. But also we launched a new non-emergency medical transportation provider that provides between 60 and 70,000 rides each month. And we've gotten really great feedback from our members on the improvements there. They now have access to a mobile app to be able to arrange their rides, as well as the website. So just improved access to our transportation services. So on the next slide, this is our objective and key results for member experience for the upcoming year. So our objective is to create the best possible member experience with comprehensive benefits, an engaged and empowered membership, and exemplary customer service. And then our key result, as I mentioned, is achieving the 95th percentile for rating of a health plan for CAHPS. And so this is our roadmap. We'll be focusing on our, if you go to the next slide, I'm sorry. Our roadmap is, starting off with improvements to our supplemental benefits program that actually went live in January. We have a new outbound outreach team that's launching on Monday, which we're really excited about. We have a new member portal that'll be going live, and then we'll be doing ongoing outreach and enrollment events, new provider contracting to continue to expand access, and then, as Erin mentioned, a lot of focus on language access, both from a customer service perspective and also within all of our materials. So if you go to the next slide, this is an overview of our County Care Rewards program. So when members go to the doctor for preventive care visits, we mail them a Visa Rewards card. So they get $50 in the mail when they go for their mammogram, and it's actually automated. Once we receive a claim, the member receives that reward on a Visa Rewards card, and then it reloads every time a member goes and has a new service. We also have extra benefits like car seats, sleep safe kits to try to reduce SIDS, and then our food care program, as we mentioned, and the full list of benefits is on our website. These are some of the improvements that we made to our rewards program. As of January 2025, we have expanded access to our childhood immunizations program. Members receive $10 every time their child goes and gets a vaccination before the age of 2. We also have removed some of the barriers to receiving sleep safe kits to try to remove SIDS, as I mentioned. We provide a bassinet, a pacifier, and a safe sleep sack. And then we have made some improvements to our vision benefits. And this was from a lot of feedback from our members that they wanted to be able to access glasses on a more regular cadence. So adults will now be able to get glasses every year with a $125 allowance or $300 for contacts in lieu of glasses. Yes.
Yeah, this is not really related to the slide or anything. We know the age range of our participants. So I guess we're going almost from 0 to the oldest member we have. It'd be interesting to look at the age of the patients we're.
Yeah, we'd be happy to bring that. We have a huge number of families and kids in our population, and we actually received 5 stars for women and children's health in the Health Choice Illinois report card this past year, which was really exciting. But just over half of our population are children.
Yeah. And could we use that to target people based upon what age demographic they fall in, or are we already doing that?
We definitely do. From like are you talking about from a marketing perspective for this rewards program?
Just from a marketing perspective.
From a marketing perspective, we absolutely do. So we look at our, we have target zip codes that we target our marketing in based on, where we want to grow our membership, where we have current membership as well. So yeah, that's definitely an area that we focus on. And then as our rewards program is of course for improving our quality scores, so trying to incentivize people to go and get preventive healthcare services, but then it's also a benefit for retention and trying to keep folks within the health plan. So a lot of them are focused within the kind of the maternal and child health populations.
And I would assume that a lot of our costs are with our members that are 50 years of age and older.
Yes.
And there are things that we could do to probably target them as well.
Yeah, that's a great point. All right, on to the next slide. So Erin mentioned some of this, but on the right you can see our very active outreach calendar where we have our own redetermination events, but then also events that we partner with other community organizations in the community nearly every day. We did over 240 redetermination events over the past year, and then we are going to be integrating clinical services wherever possible in partnership with the health system. And then we also have a partnership with some faith-based groups where we go to churches on the weekends and talk about the importance of health risk screenings, cancer screenings, and then also redetermination, and share messages around how to get connected with us at our events.
Well, it's very timely. I want to say thank you to Dr. Collins for joining me last Saturday at a church so that county care information could be shared with about 200 individuals from the district. Thank you.
Great. And this is just an example of one of the partnerships that we have this year, which is our partnership with Cook County Health and the Cook County Department of Public Health to provide free vaccinations. We've been doing this every Saturday through February 22nd, and have been providing redetermination information at each of those events. So we're very excited to share that starting on Monday, on February 3rd, we'll be launching a new outbound outreach team that will be supporting our members with welcome calls, with health risk screenings, doing outreach to members who have care gaps and need to get in for cancer screenings and other services. And also we'll be supporting them with some additional scheduling support. So we've been really focused on making sure that this team is trained and ready to go, and think that this is going to have a great impact from a member experience perspective and also a quality perspective. On to the next slide. We're also launching our new member portal. We will be providing this to ensure that members have access to real-time health information. It'll also be connected and kind of a one-stop shop for members to go to be able to schedule rides, look at their rewards, be able to find a doctor and pharmacy. And so we're really excited about this coming out this spring. All right, and with that, I will pass it over to Dr. Collins.
Good morning, everyone. Yvonne Collins, Chief Medical Officer for County Care. I'll be talking about quality, and I'll take equity. So our objective for quality is really why we're here, but to improve our members' lives by delivering high-quality, member-centered care. And our goal is really to take that 4 stars to 4.5 stars with our NCQA rating. Next slide. When we look at our quality strategy, it really is the focal areas that are related to NCQA. That is preventative care, living with chronic conditions, behavioral health, and maternal child health. In terms of preventative care, we know that if we can prevent diseases, not only is it better for the health plan, but much better for the member in terms of the quality of their life. And so we've looked at, how can we begin to bring the services to the member where they are? And so we've started some mobile services at some of our READY events, some of our weekend events. We bring mobile mammography into the community. We're looking at how we also bring dental vans into the community. You heard about our health fairs, but really looking at how we begin to scale our interventions so that we can support more of our members in terms of accessing care. And what the theme you'll hear across all 4 of these is that our hope is that we roll out really soon our new population health program. We rolled out an RFP for a population health vendor that will hopefully help us really look at our population, our health plan by populations on a larger scale, and be able to scale some of the services we need. Our outbound call center that you just heard about will help us close care gaps. Last year during one of our campaigns, we talked to members, and we wanted to know, for those of you who are not getting your services, why are you not getting services? And what we found is very commonly they want to get the service, they just don't know how to access the service. And so now our outbound call center will be able to help close that gap and really connect our member to the service. We know a large proportion of the population that we take care of have chronic diseases. When we focus on those chronic diseases, the biggest being high blood pressure, diabetes, hyperlipidemia, obesity, and kidney disease. We've enhanced our food care program to really focus on those conditions so that we can begin to not only teach our members about proper nutrition, but begin to show them what that looks like in the medically tailored foods that we provide for them. We also want to continue to leverage and expand our disease management programs. our kidney program, our maternal child program, really looking at how we look at hypertension across the span of the health plan. And then behavioral health, we've heard about behavioral health a lot this year. I'll say all of these measures were really health plan focused end to end, all departments, but behavioral health is really a good example of that. When we looked at behavioral health, we know that we have a substantial number of our members that have behavioral health conditions and substance use disorder. We know that we have limited providers, and we know that we need to provide that service. And so we were really intentional about partnering with BH providers to create a direct referral process, to enhance telehealth services, and then began to look at how can we segment the population even more. We began to look at a very small proportion of our members, but a very costly group of our high utilizers, and beginning to say, how do we get our care management teams to those members? How do we get those members to engage with us? How do we get them into services? And what we found is that once we engage with them and they know who we are and know that we're able to help them, we can increase that engagement. So really looking at providers and partners that can go into facilities when we know they're admitted, and really transition them with hand-holding really to the next phase. And so we rolled out a gold card program last year with River Edge because they had end-to-end services. And so we were able to see that it could be done. And so really looking at how we expand that and pilot that with other providers. We expanded our value-based care. You heard from Aaron where we stand related to value-based agreements overall, but really looking at behavioral health providers that can not only provide access, but also provide the quality of the care that our members need. And then lastly—
Let me just, if I could, I'm
Yeah.
sorry. What is the updated timeline for purposes of opening the Bronzeville Health Center, where we'll be providing a behavioral health service?
I have no idea.
Yeah,
I
let's
think
look
the
into
fall.
that. Okay, we'll
Yeah.
we'll find out.
Yeah.
Okay, thank
Yeah,
you.
I think the fall. Yes.
Yeah. My question is, behavioral health and mental health are two different things. And there's
Absolutely.
been an increase in mental health, and what are we doing relative to patients that are suffering from mental health conditions?
So first of all, I'll say screening. I don't think you can intervene unless you screen. So ensuring that our care coordinators and our providers are really screening everybody at every visit, especially for depression, for anxiety. And then all of the providers that we have that we're able to refer to do take care of both the mental and the behavioral and the substance use components. So I think those are our identification is number one, and then how we intervene and follow up and get them into care. The other part of it is especially when we look at maternal child, we've seen a significant number, and I think most people have now seen the reports that it's not what we thought related to maternal mortality and morbidity of high blood pressure or cardiomyopathy. For us here in Illinois, it really is substance use disorder. And how do we begin to engage with our members early on and make them feel comfortable enough to tell us that that's an issue, and then really tying them to our community navigators where they're walking along with them the entire process of that pregnancy. We're really excited. We'll be implementing doulas and lactation counselors really soon, but that doula perspective, especially for minority communities, is going to be substantial in terms of building relationships around maternal child health, because we know that's a substantial issue, so we're really excited about that. Next slide. In addition to that, we're also looking at not only access and quality, but we're also looking at making sure we have the data that we need. So very commonly, we know the member may have had the service, but we're not getting that data back. So really looking at how we improve our supplemental data. But when we look at quality, we know every single member at every single point counts. We really do believe that if we can get our members in to see their primary care providers, everything else should really fall in line in terms of care. We were pleased 70% of our members last year saw their PCPs, which was great because we want them all to see primary care providers at least once in the year. Working through timely follow-up, not only identification, but making sure members are getting into those follow-up services, both for behavioral health and maternal child. For maternal child, the other part we're looking at is for this population, unfortunately, it's either mom or it's baby, and looking at how we bridge that gap for our birthing persons to ensure that they're able to get not only the services they need, but the services their children need, and how can we begin to perhaps combine those services into one clinic so that we can ensure postpartum visits are done and postpartum depression screenings are done, but also well child visits are completed. So that's where we're looking in terms of quality for 2025 to help move us hopefully from that 4 to 4.5 rating for NCQA. I'll pause to see if there are any questions before I go to health equity.
Director Webster Cross, any questions, comments? Hearing none.
Thank you. Next slide. Our next focus will be on equity, and really our objective is to reduce healthcare inequities through the creation of opportunities for our members to not only access quality care, but to stay in their community and really help them meet their health-related social needs. You heard earlier from Christy, our two main key focuses for this area are successfully implementing policies and processes and an infrastructure to not only achieve our NCQA accreditation, but also our health equity accreditation. I think Kim has a question. I saw her hand go up. Was it an error? Okay. And then second is really beginning to identify and address health-related social needs. As we look at the waiver, which I'll talk about in a moment, but also the new guidelines that are coming out for NCQA, they're really not only going to grade us on quality of the health care around those areas that I talked about earlier, but how are we identifying our members that have housing, food, and transportation needs, and how are we actually closing those gaps? So that will be our focus for 25. Next slide. This is just a little bit about the health equity accreditation. We've already started looking at areas of opportunity. Our goal is to kick off in Q1 of this year with the goal of actually submitting Q2 of 2026. There are 7 parameters within that accreditation that we'll have to successfully meet in order to be accredited. That is organizational readiness, that is race, ethnicity, language, gender identity, and sexual orientation, being able to identify members within each of those categories, being able to have providers that can take care of members in each of those categories, access and availability to language services, and that goes beyond just the language line. That is ensuring that anytime we're communicating in their preferred language. Practitioner network cultural responsiveness. Not only am I a culturally sensitive provider, but I'm able to communicate with the member the way that they prefer to be communicated with. Culturally and linguistically appropriate services and programs along those same lines, really being able to cater to our members the way they prefer. All of these, I think, with the goal of reducing healthcare disparities and being able to prove that we're moving the needle on that. And then any services that we may delegate, how we oversee those health equity activities. So these are the 7 components that we're working through to hopefully achieve that accreditation next year. Next slide. Housing, you heard a little bit from Aaron. This is our end-to-end goal when we look at housing. We know it just doesn't start with permanent supportive housing. Really, if we take it back a step, how do we identify those members that are a risk for eviction? How do we have legal services early on for eviction prevention? How do we, if they're going to get evicted, how do we quickly move them from where they live to shelter so that they're not on the street? And then we move more into supportive, permanent supportive housing. We're really looking at the affordability of housing, housing development, and then workforce development. What we learned from the second iteration of the evaluation from the flexible housing pool, especially for our younger members, is that housing them is a stepping stone. I no longer have to worry about where I'm going to live. I can now worry about employment and education. So how do we move the needle on those? So we actually have an RFP out also for housing programs that will really help us not only work through housing services for our unhoused, but help us align more with the 1115 waiver, including transitional housing and all of the wraparound services that our members need to thrive once they're housed. Next slide. We're excited. I think everybody has heard about the 1115 waiver. It's an opportunity really to pilot different services that are not covered within the Medicaid program. The most recent 1115 waiver is an expansion of our behavioral health waiver. The application was submitted in 2023, actually, approved last year, and we're really excited to begin to move that forward. When you look at the 1115 waiver and you look at the clock of services, it's violence prevention and intervention, non-medical transportation, medical assistance with substance use disorders, substance use disorder case management, employment services. But the areas that we are really excited about and will hopefully focus on are housing, including respite, food, in addition to pre-release entry services. So really looking at the stepping stone of what that looks like. We've started to create a catalog of partners that we can work with. We've been working with HFS to really look at what the programming looks like. We gave comment in terms of how they designed it, and each MCO is really working diligently to figure out how we will implement. The goal is that we will go live hopefully at the beginning of next year, and we'll reprove, I think, because we've approved it in a lot of scenarios, the benefits of covering these services, because we can't really take care of the medically related issues if we're not taking care of those things that happen outside of the hospital. So really excited about the waiver, so more to come on that. So that's our health equity goals for 2025, and happy to take any questions. I think that's the last health equity slide.
Sorry to sort of jump in, and we've already talked about this, but with this waiver and with the other waivers that we have just generally, you know, the federal administration is you know, went after and paused all federal funds flowing through, you know, and this waiver relates directly to, you know, state and federal money. What is, I know that you can't, once you have a contract for something, you have an approved, I would assume an approved waiver, that money's locked down. Will we get a briefing at some point about where we're at with all these things in terms of what our potential exposure to an erratic administration of federal funds and extreme policy shifts? Because, you know, when this waiver expires and when and I don't know how, because these waivers are issued by the state, right?
Correct, and this one would go through 29.
Right, but the state's relationship with the federal government on the issuance of waivers. I mean, I don't know, you know, for any new waivers that we seek, what's the process for that? I'm not educated on it. I'm sure Director Harrington got much more experience in administration of health agencies. He might know this. I have more knowledge than the average person, but not enough knowledge to claim to. I will after you brief me.
In terms of the broader risks, I think we're already wedged. As you can imagine, we've been discussing, right, and talking through. We've got all of our various leaders. They've prepped essentially kind of what they see at risk under their umbrellas. We're pulling all of that together today for our strategy meeting later. And I suspect we could probably even have a summary ready for briefings potentially for the meeting next week. That'd be great. Yeah. In terms of 1115 expansion, specifically for kind of the new things, that's something we can bring an update, not necessarily how it ties to federal because we still don't know, but kind of where we're at as part of maybe the updates to the full board. So, yeah.
I just get concerned, especially considering that they've taken terms that relate to creating a more welcoming, like, workplace for people, and they are now ascribing it to, they're broadening it to programs that pre-exist, the coining of, you know, the phrase diversity, equity, and inclusion.
Yep.
And, you know, we operate a number of programs that, benefit people based on income. And I don't know how far they're gonna reach to politicize, the use and disbursement of, federal funds as it comes to renewing, grants and things of that nature. So,
It's a great point.
All right, to transition into our last section, that's focused on workforce talent and teams, just wanted to provide some initial data around, we do regular employee engagement surveys across the health system, and are able to look specifically at our health plan services team. So we had an engagement indicator score of 4.18 previously. That compares to the entire CCH organizational score at 3.84. Our team index, which is on a scale of 1 to 3, 1 being the highest, was rated as a 2 by our staff versus overall organizational of 3, and then the leader index was scored at an 88 out of 100 versus overall at 78, excuse me, out of 100. So we've, if you want to go to the next slide, we've taken some really intentional approaches over the past couple of years around how we're engaging with our staff and thinking about ways that we can work directly, that we consistently have one-on-one meetings between our managers and our frontline staff, that there's discussions around professional growth opportunities, and that we're creating an environment that the staff enjoy working in. So the surveys are a really great opportunity for us to step back and look at some of the results and how staff are providing feedback. I think one of the things that you can see here are areas where we saw our staff kind of scoring the organization highly on, and I think that's really reflective of both the type of people we tend to attract to come to work at County Care. We see a lot of really mission-driven individuals, and I think that kind of reflects here. So they, recommend Cook County Health as a good place to work. There's overall satisfied employees. They would like to continue working at CCH, and they're proud to tell people that they work for Cook County Health. So these are all areas that we saw our staff scoring on the surveys higher than kind of overall organizational averages or ahead of kind of national benchmarking.
Aaron, can I just add one thing here? So if you guys remember from the board presentation around the broader employee engagement survey, a change of 0.08 was considered statistically significant. So you can see versus overall organization, they're a huge outlier to the positive, and versus historical, they've done a lot of movement to improve as well. So well done.
Great. How many people are we talking about in terms of County Care employees?
Around 400 overall. So the next slide shows some of the areas that we saw come through on the surveys that we have opportunities on. So staff communicate a lack of understanding of job responsibilities and expectations. I think as we've dug kind of deeper into that, it's not that staff are unclear of kind of what their job description is. It's more how are we communicating all the different initiatives that we are rolling out and implementing. As you kind of heard across the successes of 2024, there's a lot of different things that we were doing. All those kind of impact staff in their day-to-day work in terms of different initiatives we're rolling out or changing processes. So taking a step back to make sure we're communicating those initiatives with staff in a way that's providing them appropriate context, also helping them understand why a workflow is changing, and also ensuring that as we're developing new processes and workflow, that especially frontline staff have the opportunity to be involved in some of that decision making and provide their feedback on how that's going to change their day-to-day work. And then integration across departments was another one that our teams highlighted. So I think as we've grown over time, there's always the potential that we get a little more siloed in our work, and I think that's this is a good opportunity for us to step back and ensure we have opportunities to integrate the different workflows across our organization. So we listed here some of the actions we're taking based on that on the survey results. So how we're ensuring that we kind of continue our one-on-one meeting structures with our staff, ensuring that they have specific conversations around workflows, processes, job responsibilities, and have that ability to get questions answered, provide additional detail. And we're also looking at how we communicate some of those changes down more broadly. How we're looking at newly adopted organizational initiatives and policies that may change those workflows, as I mentioned before, and how we can kind of further integrate that from a communication standpoint, and also how we're able to pull feedback in from staff that are in the day-to-day of those workflows. And then we have a staff engagement committee that we've launched, which is made up of a group of our team members who do a lot of different planning of activities for our team, chances for teams to interact across departments, and we do monthly lunch and learns now that provide staff an opportunity to sit in and learn about what teams across our departments do, and kind of present out on some of their work and some of the initiatives that they're working on. This just highlights some of those staff engagement activities, so things like appreciation days. We've done spirit weeks. We do the monthly lunch and learns I mentioned. We also do regular all-staff town halls where we walk through a lot of the different initiatives, status of the plan. We have opportunities for questions and feedback from staff through those avenues as well. And then in terms of the ultimate objective here is we had that 4.18 score previously. We're hoping to move that to a 4.3. Overall, as Dr. Matthias mentioned earlier, a 0.08 increase is a statistically significant increase in score. So this is about twice that we're trying to target for next year. And then finally, just want to provide a sense of some of the upcoming activities that we've got planned for our teams. And with that, I think that's our last slide before, yes, Director Harrington.
Yeah, what opportunities are there for people maybe to return to school or, increase their education, get certified? How do we do that?
Yeah, so there is, depending on a specific union contract, there's some opportunities for furthering education, and then outside of that, for non-union staff, for example, there's opportunities for some licensure, depending on how directly related it is to their job function. But then we do provide opportunities for staff to attend professional development conferences and other activities.
Do we pay for them, or do we just encourage them to go?
We can provide funding for them to go to a conference, for example. And then before we wrap up, I just wanted to quickly comment. We didn't have a policy section necessarily in this slide deck, but likely will moving forward, given some of the changes we're monitoring at the federal level. I think this past week was a bit of an interesting one where there was obviously some of the federal funding freeze announcements, and then some of the pullback on that. There has been clarity that's been offered since then that Medicaid funding is not intended to be impacted by those federal funding freezes. So from a county care perspective, we're not anticipating an impact from that. But of course, as new policy changes come out, we'll be monitoring that, and we'll share with the committee any impacts we're expecting.
That's great, great. Any other questions, comments? Hearing none, seeing none. That was a wonderful report. Thank you, Aaron and Chrissy and Dr. Collins. Thanks very much. We appreciate it. So the next regular meeting of the Managed Care Committee will be held on Friday, April 11th, 2025 at 10 a.m. And having no further business before this committee, Director Harrington, will you move adjournment?
So moved.
I'll second. All those in favor say aye. Aye. We're adjourned.
Aye.
Thank you. Thank you, Director Webster Cross.
You're welcome. Have a good day.